Greetings, my name is Renee Robles and I am a student at Front Range Community College in the microbiology class taught by Cynthia Alonzo, and this is my disease presentation for the final project of the class. The disease I chose is uterine gas gangrene. The pathogen of interest is Clostridium perfringens. Clostridium perfringens is an anaerobic, large, gram-positive bacterium. All species of the Clostridium genus form endospores and so are quite virulent. The bacteria will not grow at all under aerobic conditions, and the vegetative cells are killed by molecular oxygen, but the endospores can survive for months in aerobic conditions. The epidemiology, pathogenesis, and virulence factors. Clostridium perfringens inhabits almost every imaginable anaerobic environment, including soil, aquatic sediments, and the intestinal tract. This bacterium utilizes anaerobic fermentation exclusively for its fermentation and produces copious amounts of molecular hydrogen and carbon dioxide, as well as acetic acid, acetone, butyric acid, and butanol as its products of fermentations of sugars. When amino acids or proteins and lipids or fats are fermented, a particularly foul-smelling odor is emitted. All of these features make C. perfringens an excellent decomposer. However, in the human body, it is one of the most deadly known pathogens. C. perfringens produces hemolysins, proteases, lipases, collagenase, and hyaluronidase, as well as several exotoxins, 4 of which, the alpha, beta, epsilon, and iota forms, are especially deadly to humans. These virulence factors are what leads to the characteristic symptoms of C. perfringens infection, gas gangrene. The hemolysins lead to hemolysis of the red blood cells and subsequent low blood pressure and shock in the patient. The various enzymes destroy the muscle tissue, fat, collagen, and skin, which results in the myonecrosis of the various body tissues. C. perfringens is naturally resident in the body, but unless there is dead tissue, the body's innate and acquired immune systems keep the infection in check. However, when there is severe injury to tissue, such as decubitus bed sores or compound fractures, incomplete abortion, whether spontaneous or induced, or incomplete expulsion of the products of conception after childbirth, this dead tissue provides the perfect anaerobic environment for C. perfringens to thrive and multiply, and an abundance of nutrients upon which it can feed. Modern obstetric practice has made gas gangrene almost a thing of the past, something that goes in the attic with smallpox, black plague, and amputations of broken legs. However, with the slow erosion of the right to and availability of safe, affordable, convenient, and medically supervised abortion, more and more women are seeking out home-cooked options. Most are opting for medical abortions via pills that are obtained over the internet from sources outside the USA and outside the oversight and regulation of the FDA. Proponents of such procedures claim that these pills can be taken safely at home, and that any reasonably intelligent woman is perfectly capable of supervising her own use of the pills. However, even in this case, or in the case of spontaneous miscarriage, the products of conception do not always empty completely. If any of the products of conception, pieces of the placenta or fetal parts, are retained regardless of the cause of the abortion, the woman runs the risk of hemorrhage and infection. And this circumstance gives the anaerobic nature of the dead tissue in the womb an engraved invitation for Clostridium perfringens to take hold. Other risk factors are cancerous tumors, endometriosis, and diabetes, all of which can offer this vicious pathogen the necessary anaerobic environment and banquet of dead tissue upon which to feast. And these are just the sanitary situations. Never mind the women who, desperate to rid themselves of unwanted pregnancy, regardless of their motives, poor, without access to proper medical care, relying on myths and literally old wives' tales. Insert pieces of elm bark, rusty nail files, hangers, and other implements best not imagined. into the vagina, perforating the cervix, the rectum, the uterine wall, macerating, a fancy word that means chewing up, the fetus, and introducing C. tetanus and C. perfringens into the womb if it wasn't there already. It is difficult to imagine from the safety of California, in the United States of America, that there would be any social disgrace or economic setback that a woman could consider to be so severe as to justify such an ugly and horrifying death. But sadly, around the world, there are all too many. Symptoms and signs. The patient presents with vaginal bleeding and intense pain, and high fever, often over 103 or 104 degrees Fahrenheit, a thin, thready pulse, shallow, rapid breathing, barely measurable blood pressure, cold, clammy skin, and clear evidence of shock. Sometimes the lower abdomen will be rigid and tense. In other cases, it will be soft and boggy. At first, urinary output may be copious, but later urinary output will be scant, despite the profuse amount of fluids given intravenously. The urine will be dark and foul-smelling, and the bloody discharge from the vagina will have an even fouler odor. X-ray images will show gas in the muscle tissues of the uterus. Large, fat, gram-positive bacteria will be obtained from the tissue, pointing immediately to C. perfringens. And history of pregnancy and or recent abortion will sometimes be obtained, but not always. However, upon autopsy, and autopsy is the sad sequela of uterine gas gangrene in too many cases, the necrotic remains of a fetus and other products of conception will be found in the womb. Whether through fear of social or legal sanctions, all too often, the woman and her family or partner will lie to the clinical staff and deny the possibility of pregnancy or any attempt at abortion. However, again, the autopsy will tell the truth. Treatment. Time is of the essence because gas gangrene and systemic septicemia will move fast. The best treatment is immediate administration of appropriate antibiotics and antitoxins, surgery and debridement of the necrotic and infected tissue. Often this means an aggressive radical hysterectomy. The patient will also need to be watched closely for shock, loss of blood volume, loss of blood pressure, lack of urinary output, kidney function, hydration, and electrolyte balance. 50 to 75 years ago, there was much debate over the effectiveness of surgery and debridement versus aggressive antibiotic therapy. However, so many patients died, regardless of the treatment, that it was really hard to draw any meaningful conclusions. Today, immediate surgery and removal of as much of the necrotic tissue as possible, eliminating the anaerobic environment and removing the source of nutrients, with aggressive antibiotic therapy and antitoxins, as well as palliative care to treat and prevent shock and septicemia, is the treatment of choice. However, these heroic measures often fail, even after the clinical staff has breathed a collective sigh of relief and sent the patient home in stable condition. The bottom line is, in spite of the best efforts of the most modern hospitals, uterine gas gangrene, while rare in our society, is still a vicious and formidable killer. Prevention. Almost every article and journal paper I read ended with a strong recommendation for legal and social reforms that will make abortion safe, legal, affordable, and easily available. Attacking the social problems that lead a woman to seek an abortion is a problem for another day. However, there is nothing short of heartbreaking to realize that in the 21st century, women are still dying in such an ugly and medieval manner due to lack of proper obstetric care and safe legal abortion. Again, I would emphasize that even a pregnancy where there is no abortion can spontaneously miscarry, and even a full-term healthy fetus can die in utero if the mother does not receive adequate prenatal care to prevent diabetes and eclampsia. C. perfringens will care not how or why. The two necessary ingredients are at hand: anaerobic environment and necessary nutrients, just as they are. And whether it's an unfortunate miscarriage, retained placental parts after successful delivery of a full-term fetus, a tumor, diabetic necrosis, kidney disease, or eclampsia, the horrific result will be the same if uterine gas gangrene sets in. Now, before you close off, please take take a few seconds to photograph my resources.
Photograph or videotape?
Videotape the resources, just maybe 10 seconds each. Tell me when to go up.
Mm-hmm.